Hey, everybody, it's a daily dose of Dr. Drew. Here's Dr. Drew.
Wow, thank you very much. Hello, everybody. Again, as usual, I'm following the feed here on Facebook and Periscope, so if you have your questions there, I'm happy to do it. We're going to try to do a daily dose nearly every day. We're going to maybe have we may miss a couple days next week, but it's something I want to try to do on a regular basis, where we just interact for 15 or 20 minutes, get what's on your mind, I'll tell you what's on my mind, and share a little bit. One of the things I've been thinking about is, and I saw a little bit of rhetoric around this last night at the Golden Globes, which is need for more positivity and more connection and more personal accountability, more unity, and that is on my mind a lot. So you're going to probably see me talking about that in one form or another, hopefully going forward for a while. Hi there, I see you all saying hi, you live, hey, but any questions? Oh, John Leiterman, how are you, man? Haven't seen you in a long time. Again, this is a place to ask. Try not to be too complicated with the questions in terms of your own personal stories, but if you have specific questions, I want to try to answer them here with you. And Richard, thank you for enjoying last night's show. We do a Sunday show called Ask Dr. Drew, which is specifically a call-in show. We do a couple of hours, maybe a little more, usually with some guests. Next week, we are going to try, I believe we'll be dedicating the show to hallucinogenics and their clinical utility. It's something I've been thinking a lot about for quite some time. I wanted to actually do a documentary on this. And
at the request of your daughter, who is our guest.
Who's interested? Well, you have to hear what she has to say. Joshua, is that your name? Yeah, asked a really interesting question about wellness. I want to try to address that in a minute. The hallucinogen story, though, is a story that is very complicated. These are substances that clearly have some utility in mental health. The question is, at what risk and at what exposure level, and exactly how to be deployed, and how do we do the studies safely enough to be able to determine how these things should be used. So there's a lot of complex questions to be asked and answered there. But hopefully in the short term, well, not hopefully. I mean, the fact is people are taking matters into their own hands and are using these things on a regular basis in many different contexts. My fear is that down the road, we're going to find that there are some really serious consequences neurologically from this. I mean, think of all the energy we're putting into chronic traumatic encephalopathy, which is this, recurrent head trauma stuff. This may have a similar kind of effect on the brain, so I'm worried about that. But we'll see. We'll get into that, and we'll talk to some people that have experience with it. All right. One question here is, why do doctors prescribe benzodiazepines when they are so bad for us? They're really great medication. They're very compelling for doctors to help people relieve suffering. They are very dangerous. And unfortunately, I don't believe that my peers really accept how problematic they can be. And particularly for some people who are highly sensitive to these medications, they can be extremely problematic. So there's been a excessive liberal prescribing of these medicines, much like the opiates. I've been calling the benzodiazepine story the hidden epidemic. It's hidden behind the opiate story. And back when we were seeing all the pharmaceutical deaths, the prescribing deaths, it was the addition of the benzodiazepines that caused the death. I think of Prince. It's a perfect example of that. So, all right. Yeah, well, Luke, you said you're using mushrooms, and I said stop. Yeah, because we just don't know. So I can't recommend anything yet, but I'm interested to talking to people who have used them therapeutically and do think they have a utility, and just explore what their experience has been. So wellness. Joshua asked a question about wellness, and this is another concern I have. I feel like we have lost track of the difference between psychological wellness and psychiatric illness. They barely overlap. There is an overlap between them, let's be fair. And environmental stressors and environmental events like trauma can add to triggering psychiatric pathology. There's no doubt about it. But wellness is kind of a different topic. It's more like optimization. It's almost like saying, how do I optimize my training and exercising, as opposed to how do I do physical rehab when I've broken my hip? Those are two entirely different phenomenon that overlap but are different. And the same thing is true in mental health. We somehow have a fantasy that wellness will necessarily result in diminished psychiatric illness, which I'm sure it will to a small extent, but not necessarily. There are a lot of psychiatric illnesses that have a high degree of biological proclivity associated with them. And so, yeah, wellness is helpful. For instance, with, say, illnesses like schizophrenia, which are primarily genetic phenomena that are turned on biologically in age 18 to 22, things like cognitive behavioral therapy can reduce the symptomatology and how the patient relates to that symptomatology. Yeah, CBT. That's treatment. That's not wellness. Wellness people are often thinking about things like mindfulness adds to wellness and well-being. Again, well-being, not no illness. So well-being, sense of well-being, sort of purposefulness and a sense of being okay in the moment, as opposed to eliminating anxiety disorders or necessarily treating psychotic illnesses or preventing these things from happening. There's a lot of confusion about this. I've noticed in a, particularly in like the corporate world, they want wellness so there's no mental illness. Like, it doesn't work like that. That's like saying I want physical, I want everyone to be engaged in a physical program of exercise so there will be no bone fractures. Well, that just doesn't necessarily relate. Okay, let's, John had some CBT to work for you. 10-minute nurse practitioner diagnosis is the norm today. So this is Neurotone making a point about how limited our access to mental health services are for true illness. And I totally agree with you that we not only do we need to improve access to expert evaluation, we have a massive shortage of psychiatrists. And I believe that psychologists and licensed clinical social workers can fill in a lot of that, but we haven't integrated it properly. And we need the psychiatric sort of overlay and management. We just don't do that yet. Also, a lot of the chronic mental illness needs to be dealt with in a sort of a community treatment setting, a setting where people can engage in vocational rehab, can engage in rehabilitation activities, can engage in the world, get transportation, and learn social skills in a community setting. Call it what you will. That's what we used to do in a psychiatric hospital, but we can't use those words anymore. Make it a cool environment, but we have to be able to place people there, and we don't have the laws in place to talk about it, to be able to do that. Is there a genetic component to borderline and bipolar? So this is Dr. Bipes, BIP. There's a lot of controversy about this, how much of bipolar is genetically programmed, and same thing is true of borderline personality disorder. And some people even believe that borderline and bipolar have an overlap syndrome associated with them, that to some extent they are maybe a similar or at least a common source disorder. So it's something that can't be answered with certainty. Yeah, Timna, I see you there saying yes to the community setting. I know it doesn't exist. It does exist in Trieste, Italy. Look at the Trieste model. It's something that I know, thank God, Los Angeles is looking at. I've seen their plan to actualize it. And they've taken something that is actually relatively simple and made it complicated, which is, I guess, what government does. But good. So fine. Actualize it. Get it going immediately. My fear is there will not be the ability, it will not be big enough or there will not be enough of them, and we won't be able to place people into these programs. Okay, we're getting, Miss Producer, we are getting a note that we have to change our profile avatar because no one takes anyone with a default picture seriously. Okay? That must be on Periscope.
Wait. Sorry, I didn't have my
in other words, I guess on Periscope, or it must be Periscope, we don't have a picture up.
We do too.
Well, it says we have a default picture. We have a default picture up there.
I see her head on there. I don't know.
Maybe YouTube or something. I don't know.
Oh, wait. Let me look.
All right. Faye, that's a tough question. That's too specific. You have to talk to your doctor about that. I have mixed feelings about it. Yes. Chow. CBD, is it really effective for pain? CBD is a very complicated topic. CBD without any THC is what I'm talking about. And CBD, again, that has proper testing for purity. So you have to be careful who you buy the CBDs from. And I'm an advocate for low-dose CBD. Okay, that CBD, I had some patients, even with topical CBD, have some rather striking response to pain and discomfort. I've mixed results with sleep, a mixed result with anxiety, but it's something that seems to be quite safe, though we don't have all the clinical data yet for me to make a formal recommendation on these things. So at this point is just anecdotal. Okay, thank you, Enlighten, about the profile.
I think it's Twitch.
Oh, Twitch.
That's a new. Oh no, Mixer.
Mixer.
That's Caleb's thing. Thank you so much. We'll
Yeah.
fix that.
And yes, we will do that. It's on Mixer. Oh, good. So Princess Di says CBD helps her with sleep for sure. And I've heard that reported by many different people. I've also had people have disrupted sleep. I've also had people get panic attack the next day. So again, what percentage of people is it going to help, and how do I coach patients up? That's a hard thing for me to say. All right, give me a second to scroll up on your stuff, see if I missed anything here. Jason Ellis, yes, thank you for that. Somebody's asking about the Trump derangement syndrome, and obviously that's not a real syndrome. Yeah, Susan, it may be better with THC, but the risks then go up. Somebody wants to know, is narcissism a mental disorder is curable? Narcissistic personality disorder, some people would argue that personality disorders are not curable. They are manageable. In other words, you can give people certain kinds of treatments that help them create a self-awareness around some of the symptomatology that the personality disorder sets them up for. I have seen personality disorders change in the setting of recovery from addiction. So my hypothesis is, and I have no literature to back this up, that when somebody was faced with they must change or they will die, that magically that's a circumstance in which some of the personality stuff can be changed. But absent that, you can only sort of work around the edges on the manifestations of the personality function. Lamictal is a good medicine for bipolar disorder. It has the risk of the big rash, but if you can tolerate it without any rash, it's quite a good medication. Okay. Back to the Trump derangement syndrome. I am generally concerned about the hysteria of the last year, that people's hair had been on fire all the time with every little thing. I personally have been upset all the time watching. I don't have a strong position one way or the other, so I watch MSNBC and I watch Fox News and I listen to different talk outlets and different websites, and I see both stories that are being told. As Scott Adams would say, it's two different movies on two different screens, and it makes me a little crazy because both sides are hysterical about what they're seeing, and I can't figure out what the reality is. And I've been inside the executive branch of the government recently and have been pressed by the personnel that are there, so I know none of that's getting out. That's reassuring. Some of them are really going to make some very, very good decisions and have some important policy input. Why people are so affected by it, I guess you can listen to the Scott Adams podcast I did yesterday. I think, is it up as a podcast now, Ms. Producer?
It will be,
Okay.
but it's on Periscope and Facebook Live.
All right, it's still up on Facebook
and YouTube.
Okay, it's up there now. And
Most
I
recent.
was asking him that same question. What is this? How do we reduce this hysteria? He doesn't really think it's going to reduce, it seemed like to me. I kind of feel like there's a middle ground, and we all need to head towards it. And that middle ground needs to be a place of reason and community and unity and reuniting around the basic principles of our government. I think it's worth all of us to take a look at the basic principles upon which we all agree. I don't know if you saw the Golden Globe last night, but they had a big tribute to Tom Hanks, and at one point he is saying what makes us Americans, this was in one of his films, is that we agree to the rules, and the rules are laid down in this thing called the Constitution. And the Constitution was a document to form a more perfect union amongst the states, not to have a federal government that's going to take care of everything and tell us how to live our lives. It's to give us a structure, a federal structure, to perform a more perfect union amongst the states. Then we leave a lot up to the states. Now, I know the states have gone haywire. I've been studying recently the Reconstruction era, the post-Civil War, and it's a period of history that I am literally embarrassed I didn't know more about. And it is, I believe we're still under the shadow of that heinous. We don't even think about it or talk about it. It's that heinous. If you want to study it, read Frederick Douglass's biography, read Grant's biography by Chernow, and you have an obligation to look at these things, I think. And as such, I understand people want the federal government to make sure that doesn't happen again, and I get it. There's certain things that we have to rely on. But one of the areas where we've run amok is the federal government got involved in mental health care, right? In 1963, we signed the Community Mental Health Act, and for the first time in the history, not specified anywhere in the Constitution, it had been vetoed by previous presidents, President Kennedy laid out a plan where the federal government would be responsible for mental health services, and one of their goals was to shut down, to literally shutter the mental health system that had been operating for 150 years in states throughout the country. Now, the problem with that, aside from the fact that it's not specified in the Constitution, the problem is they made zero provisions for what to do with the hundreds of thousands of people that were pouring out of the psychiatric facilities. They were not appropriate for community mental health services, which, by the way, those community mental health centers were designed to, quote, prevent mental illness. That was their stated goal, which, as I said when I was talking about the wellness and mental illness thing, we don't really know how to do that. So they were abject failures. Then we did not fund treatment for people who have chronic mental illness. It's called the IMD exclusion, which I'm hoping the current administration is going to undo. They have a pilot program going in Washington right now. The IMD exclusion is hopefully going to be reversed, so we will have funds available for the chronically mentally ill. The community mental health centers were abject failures. And no provisions were made for the resistant patient, the chronically ill patient, the custodial care need patients, and they poured out into the streets, the prisons, and the nursing homes. They don't belong in any of those places, right? And they certainly don't belong in prisons. So I'm in favor of that having been pushed aside. They don't belong in nursing homes, though some have to go to nursing homes. They are that ill. And they don't belong in the streets. We need to have some other structure to help people. And by the way, I've said it before, every other country on earth takes care of sick people. We don't. Even those, if you want to look at people that, let's say, legalize all drugs, like Portugal, they have a provision for what to do with drug addicts who are sick. They don't just legalize drugs, then let people with illness, addiction, just die on the streets like we do. They make a plan for how to deal with the consequences of the legalization of all the drugs, and they manage their ill. We do not. And we actually privilege illness in the law, protecting it from care, which is just the most bizarre thing ever. As someone who's worked in a psychiatric hospital for so many years, I just can't imagine that my patients are there. Okay, so we need the Trieste plan. Take a look at it. I think you'll like it. Compromise, I agree with you, my friend. I'm just looking at your scroll here, see if there's anything. Wellness for the homelessness, Joshua. I don't think that's going to do very much. Because they're dying in the street. They have fatal illness. Wellness is not going to turn a fatal illness around. Mrs. Pinsky, I'm hearing the front door ring. Are we about done here, you and I?
Well, the dogs just had a bath, so you'll be hearing them come in.
I know, but
somebody
I don't
said we should bring calling out back.
Why don't you do that?
I might actually on Wednesday, so tune in. Okay,
Mrs. Pinsky is going to, Miss Producer Susan Pinsky and Master of Call Things Calling Out is going to bring out that program. All right, so I don't believe anybody's here to get the door, Mrs. Pinsky. Your son starts his program.
He knows to let the dogs in.
He's not here.
No, the dog groomer knows to let them in.
See, we're using our headset as our personal communication system right now.
A day in the life.
A day in the life. Here we go. So anyway, I think we've done this about 20 minutes here, and that's usually what we're trying to do. Okay, what are some of the best things you learned about achieving successful long-term? She wants to know about what we have success in a long-term romantic relationship. What aspects would you say are most important? Oh, I just happen to have my significant other on the line here. Go ahead.
Oh, God.
Come on.
Marry a great guy.
Oh, yeah. Nice. That's called deflection. What else you got? You must have something better.
I don't know. Just have a good sex.
Well, okay. Okay, so be attracted to each other.
Sexual relationship.
Be attracted to each other.
That's always really important for me.
We're both really good at commitment, I think.
Yeah.
We are certainly, we have both came from families where family was important, and rupturing that family was not something anybody put on the table. So we don't even think about that.
I don't know if being honest about everything is good. Holding back some of your thoughts is sometimes really good. Somebody said honesty, but being too honest sometimes gets you in trouble.
Well, I would suggest that.
I mean, honesty and being an honest person, obviously, but I feel like being nice to your significant other all the time and trying, not trying to be too honest is sometimes a good
Here's the
good
way to think
idea.
about it. Think about it the way we think about amends. So you're recovering from a drug addiction. You've been in recovery at 8, 12 months. You go out and you make your amends, which is cleaning up your side of the street. You don't do it when it's your concerted opinion with working with somebody else, not on your own necessarily, but you think, because again, you might be trying to avoid something unpleasant, but if you and your sponsor decide that it would be harmful to the other person to be honest and make amends, then you don't do it if it's truly harmful.
Or
But-
just
but-
in
but
daily
then-
life, you don't always have to be honest. all the time.
Then you make a living amends. If something you've done would hurt somebody else, you live the rest of your life in such a way that you don't allow that to happen again. So living amends can be very, very powerful. All right, we're going to
a lot
wrap.
deeper than where I was going.
I understand. You're just saying day in, day out, just let things slide.
Well,
And
I think men are very sensitive, and I'm just gonna say this: you have to be nice to men. You can't just always be telling them what's wrong with them or how they have to change. And Drew's a workaholic. I knew that my entire relationship, and now that we're older, it's a little different because he doesn't need to work as much. But I mean,
now she gets trouble
I
when
didn't
I'm
complain
around.
about it all the time. I just learned to live with it and kept
And-
my mouth shut.
And now you don't
It
like
worked
it.
out.
Now you don't like it when I'm around too much.
Yeah, I know. You need to get a job, dude. See, that sounds so honest.
Fair enough.
No, I love being with you, and this is really fun. I'm having a good time.
Right. That's another thing, having mutual projects and mutual aims and mutual values, all very, very, very important.
But the ladies can agree that you're really good looking, and it's fun to get you on video and hear what you have to say. So I'm 100% behind that.
So I guess she's giving you an example of something else you should be doing, some sort of weird empty platitudes, I think is what she's advocating for. So, all right. So I want to wrap this thing up. We've done 20 minutes, and I don't want to go too, because this, again, let me just remind you, you can sign up at drdrew.tv, and you'll get the blast on Sunday when we do the interactive shows that are on phone lines where we actually take calls. And, Mr. Producer, I think we had to do some shows where we just do phone calls and not have guests.
Sure.
Because I get behind on the phone calls, and I feel really guilty about that. So, okay, we'll do phone calls on one of these days. Although this weekend we're going to be doing a show on hallucinogenics. We're efforting really good guests for that. Go to Dr.
Well, actually, your daughter is your guest, and she suggested talking about it, and it just
It's a good idea.
evolved.
It's a good idea. Dr.Drew.com, you can check out This Life You Live, the Dr. Drew podcast. Adam and I do a podcast every day still, or at least most days.
You were on the Adam Carolla show.
And I'm on the Adam Carolla show right now. If you get the ACS show, you can see that I'm on that show presently. But do tell a friend about this particular show. I think this is going to be a lot of fun where I can interact on a daily basis. We'll just be here. We're going to try to hit around noon Pacific, and we're going to try to do every day.
And then sign up at drdrew.tv if you want to be on the notification, email, and text on Sunday.
And speaking of email, if you go to drdrew.com/contact list and send emails, the producer looks at those pretty carefully and sends them to me. I'll try to. This is something we can add to this little show, which is the email stuff. And don't forget After Dark at your mom's house. If you're a fan of your mom's house, there's a Robert Paul Champagne home tour coming up any day now, and it's astonishing. It's astonishing, and I'm going to have to do a little review of that maybe over at your mom's house with Tom Segura and Christina P. So check it out.
Colin said he loves Paulina.
Colin.
Paulina Pinsky. She's going to be our guest this weekend.
Oh, check out, I retweeted some stuff. She's trying to make a living as a writer right now, and so maybe support her cause. If you check out
She
my
has
Twitter
a blog, but you'll hear more about it on Sunday.
feed. Okay, really good.
She's moving along. She's got a really good following. People seem to like what she has to say.
Thank you guys for showing up, and we appreciate it. Again, send in on the contact list. Send us other things we can do that would be helpful. I have a lot of stuff that I want to just give out, to the extent that we can in this kind of medium, in terms of helping people and giving information. And our goal is to educate and do good. So if there's ways that we can do that better, and you think there's things you'd like to hear about, send the email at the contact list at drdrew.com, and I'll see you tomorrow.
Okay.